First of all, why we study Nasopharyngeal Carcinoma or NPC? I think it's easier to remember when we talk about NPC. And also known as nose cancer. So, remind you of which famous person? Yeah, Lee Chong-wei. Yeah, so why it's so important to study NPC? The first thing is you can see that it's more than 85% of cases actually come from Asia. Like globally, it's considered as a rare cancer, but most of the cases actually come from Asia. And in the past, it was actually regarded as Cantonese cancer because it's always happened in the southern part of China. And in Malaysia, for the past, 20 years since we have this cancer registry, NPC is always the top 5 cancer, the most common cancer in Malaysia. And in the world, Malaysia ranks number 4. So we want to be at the top position, but not for this reason. But unfortunately, we are. And this is a very unique cancer, not only because it's common in Asia, and also common in certain ethnicities. Like, as I said just now, Chinese is considered high risk. And actually, Sabah and Sarawak, like the Bidayuh, Iban, Kadasan, also very common. And the challenges for NPC management, one is the late presentation. And you can imagine, because the tumor is inside your nose, so if it's early, you can't see, you can't feel. Actually, the symptom for early stage is very unspecific. Like you have blocked nose, you have maybe a headache. So you won't really take too much notice. So there are many people overlook the early symptoms. So when we have this outreach program, we always say that if you have this, let's say minor discomfort, but it's persistent, like more than 2 weeks, then you need to be aware. So late presentation, and it's more than 75% of the cases diagnosed at late stage, stage 3 and stage 4. When we want to do research, we actually couldn't get any early stage samples. And you can imagine, because the tumor is inside the nose, it's in this head and neck region, so the patient or survivor always suffer from a very severe side effects. And unfortunately, there is no targeted therapy. So compared to the cancer like breast cancer, lung cancer, colorectal, that are so common around the world, there are so much research being done in the Western country. And this NPC, sometimes we call it Cantonese cancer or Asian cancer. So you can imagine that why Western country wanted to invest so much money to do research. So currently, the research on NPC, the most extensively done is China, because now they are coming up, they have money, they have people, and then they have samples. Yeah, so, and due to all these reasons, next slide, please. Yeah. So the NPC Society of Malaysia was established in 2010 by, there are 4 key founders. I was one of them. So I'm a scientist, I'm a cancer biologist. And together with 2 medical doctors, ENT specialists, and also another scientist. So our aim is to establish the society to support research on NPC, and also to promote awareness. So actually, NPC, if you detect it early, your cure rate actually is 99.999%, because it's very, very sensitive to radiotherapy. So that's why its early detection is very important, particularly for this disease. So we established this society with a vision to reduce the burden of NPC in Malaysia. So we focus on 2 missions. One is to support research, and the other one is promote awareness. And my EXCO member has presented the promote awareness in theme 1. So I'm now talking about research part. Next, please. Yeah. We currently have 147 members. It seems big, but actually the active members are not many because many of these members are students. So they joined the society, got the free registration to the meetings, and then they graduated. So they're not working on NPC anymore. And most members are mainly scientists and medical doctors who are keen to develop new ways for a better management of NPC. And this was the first activity that the society organized. We organized this international symposium on NPC in Penang, like 2011, 1 year after we established the society. So after this, we have been organized with so-called Malaysian NPC Research Day every year to bring together all the NPC researchers across the country from different universities and different institutions. Like one day we get together to share data and then to exchange ideas. And when the budget is allowed, we will invite some speakers from overseas. And of course, we always invite our local researcher to give a talk in the meeting. And actually, our next upcoming meeting is in March. So, because this is a society consists of members from different universities across Malaysia. So what I'm doing here is I try to summarize the research areas from all the NPC researchers in Malaysia at my best knowledge. So there are two key themes that we are trying to do. Just now I mentioned that late presentation is one of the main challenges. So there are groups doing early detection. The aim to develop or establish affordable method and non-invasive. Currently, the standard way to diagnose NPC is to through scope. Means that you get a probe, go inside your nose, and you have to do it by the specialist. So it's not that convenient per se. So we try to develop the methods that are more easier and also accessible for remote communities. As I say, that is very common in Sabah and Sarawak. And for them to travel to the hospital is quite tedious. So hopefully we are now talking with a company from China and Hong Kong that are quite interested to validate or test their kit in different countries. And that identify Malaysia is one of the countries that would like to collaborate with. So hopefully I will be able to tell you some good news in the future, near future. Yeah, thanks. The second one is the novel therapies. So this, most of them are basic research with an aim to develop, with the ultimate aim is to develop novel therapies. So we don't rely on this traditional chemo radiotherapy, which cause a severe side effect for the patients. So the first thing is try to identify biomarkers for diagnosis, prognosis, and treatment. So diagnosis is easy to understand, it's early detection. Prognosis means that we are, including my group, is try to use AI technology, because everything is AI now, to predict recurrence. Because currently there is no indicator, like two patients comes in, who were likely to develop recurrence. So this is always a big challenge. And we now try to use AI technology to identify which group of patients are likely to develop recurrence so that they can be monitored more closely. And treatment is, of course, is novel therapy, like I will mention about immunotherapy, the second point. The treatment or targeted therapy that can cause lesser side effect to the patient. This is very ambitious, but this is our goal. And the second point is refine immunotherapies. So, okay, so I saw this. Okay, last slide. And NPC actually is a virus-associated cancer. So the virus is called EBV. Almost every tumor cells contain the virus. So we actually use this characteristic can develop immunotherapy. So what we are trying to do is to understand tumor microenvironment, how it affects the efficacy of the therapy. And I mentioned about Sabah and Sarawak. So we also try to understand the ethnic variations. So whether the people is genetically different or because of the social factors. You heard about just now the previous talk about the culture, the thinking of people actually can be quite different. And also have group established NPC models for research, like for mouse model or for cell lines. And this one is a drug repurposing, means that we all know that cancer drug is so expensive. So what we're trying to do now is to repurpose, let's say, a drug for dengue, just for example, for dengue, but we use it to treat cancer. So we call it drug repurposing. So we are currently working with in a group in UK. So all these projects, we have extensive collaboration with local and international research group. So I can say that after all this year effort with all the NPC researchers in Malaysia, the NPC research for Malaysia actually now been recognized in the international community. So we always, I think once in 2 years, we have this NPC conference. It's the biggest conference. So Malaysian NPC researcher have been invited to give a talk. So yeah. And then my last, next slide, please. This is surely the last one. It's just a contact. So if you want to know more about the society, you can visit our website. Yeah, so I didn't put my name here because I forgot it's a last minute slide preparation. And you can just search my name and and then you can get my contact. Or you just go to the society, they will be contact us, and then the email will direct to me. Yeah, thank you. Okay.